Hi guys, it's your favorite nurse educator, N.P. Clark, and I'm here with another cup of the morning coffee. In today's cup, guys, we're going to talk about liver cancer. And I know that's a heavy topic to talk about on a Monday morning at 7 a.m., but we're family and we've got to talk about those hard topics, okay? So let's get started. So the liver is located in your upper right abdominal, belly, whatever, stomach, whatever you want to call it. It's in this area just behind the ribs, right? Now, I say that because with liver cancer, at times that liver is going to become enlarged, and so you will be able to palpate or feel the liver just under that rib, and it's going to be enlarged, or hepatomegaly. So if you've ever heard that. Now, there's other things that can cause hepatomegaly or an enlargement of the liver, but this is one of the things that we know for sure at some point in your diagnosis will cause that. Now, I want to be very transparent. There is no cure for liver cancer, no cure, but it can be treated and slow the progression or the growth of the tumors. So the liver has two lobes, a right and a left. So obviously you would be a little better off if there is only a tumor on one side of the liver rather than the both sides. However, tumors are tumors. So next. Early on, when people have liver cancer, most of the time there are no symptoms to them. So as it progresses into the later stages, whether it's stage 2, 3, 4, and so on, you want to be aware that sometimes you can have a bloating, ascites, which is swelling of the abdomen, and it's mostly fluid in there, just a collection of fluids. But again, you won't know unless you go and get checked out. So you can also have some nausea, weight loss, bloating, some chalk-like stools, things like that. Those are all things that you guys want to check into and have checked out from your primary care provider, whether it's a physician, nurse practitioner, or a physician's assistant. We want to make sure that we are on top of it. Nobody knows your body better than you, but you have to know your body, guys, okay? Now, next, there are some treatments. So whether that's going to be, obviously, we're always going to say change in diet and exercise, decreasing stress, all of those good things. However, there's chemotherapy, maybe removing part of the liver, and then also a complete liver transplant, and then even radiation in some cases. It just depends on how severe your type of cancer is and what stage you're in. Now, and as I said, although no cure, those options are available. There's also like a cryoablation, embolizations, depending on where that cancer is located in your liver. And so then I want to kind of tell you that in treating liver cancer, this has to be a collaborative effect and approach to this. So as your primary provider, I'm going to call in the big boys. A hepatologist. Hepat is liver, and then ologist obviously is the person who's going to study that. Now, you can also go to a GI specialist because they deal also with the liver, the spleen, and all of those types of deals. However, for me, I prefer a hepatologist if you have one of those people available in your area. And then also an oncologist, because that is the doctor who knows about the specific cancer that you have. So of course we want all of the heavy hitters. We want the people that are going to be the specialists in that area. Now I want to repeat that because a train went by. I am actually filming today from Atlanta, Georgia. I came to visit my daughter, who is a sophomore at Spelman College. So that part where I was saying we want to, as your provider, I want to get a hepatologist or liver doctor, an oncologist or cancer doctor involved in the care. And at times even a hematologist, which is the doctor for blood. So we're going to be a collaborative team working together to ensure that you get the best care and the best options possible. Now, you guys know I've made a palliative care and hospice video, and we're not going straight to hospice. However, liver cancer, most of the time in the later stages, you're going to have pain. So palliative care, such as OASIS, palliative care and hospice, You know, I always have to put in a shameless plug there. Hakeem Bello and his wife and their wonderful team, they provide palliative care, which is a management of chronic conditions that may cause pain and things like that. So they are there to improve the quality of the quantity of life that you have, right? Now, I'm not here to tell you that you're only going to have a day or two. That is not my job, and that is not what I try to do. But when we're dealing with liver cancer, guys, we really have to focus on quality of life, which means I don't want you to have pain. Of course, that weight loss, and you know, we know with a lot of people with cancer, it looks a certain way. So that also then sends us into like a mental health type of a condition. So we want to make sure that we are even involving the social workers, getting your family in and talking to them, educating them on how to help you. As many resources as we can get, that is my aim as nurse practitioner Clark. So again, I'm going to wrap up. If you have questions, comments, concerns, or you want to discuss this topic further, please leave comments, like, share, subscribe. We appreciate all of the support that we are getting, and we will see you guys next Monday for the Morning Coffee Talk with MP Clark. So thank you.